Hi everyone, this is Dr. Catherine Kenyon again, and I want to thank Dr. Beal for the use of her slides to talk about childhood poverty. Again, the goals here will be that we're going to look at what is poverty in the U.S. and how does it affect people over socio-demographic areas as well as the healthcare systems. So we're going to start a little bit with some definitions. How do we define poverty? Poverty threshold is updated annually by the U.S. Census, and it's only used for statistical purpose, whereas the poverty guidelines are used by the Department of Health and help determine if someone is eligible for a program. I was able to pull the most recent update, and you can click any of the links below that are throughout this presentation to take you to where this information came from. So there was an adjustment for what's considered below the poverty line if your pre-tax income for 2023 was at $30,000 or less. What's not adjusted for in the official poverty measure is that foods tend to cost less until the inflation came for 2015, but there's not any adjustment here for this. The cost of living based on your geographic region, and there are a couple slides further down that show how dramatically different it is depending on where you live. No adjustment for higher cost for non-food things such as transportation, childcare, and especially housing, and any benefits that that family might need. Now, we have had supplemental poverty measures which do take that into account and do adjust for variations based on geography. Here's what it's a little short video of what it's like to live at the poverty line to give you an idea. So 44% of children are low income, and in that category we look at, are you at the poverty level, near the poverty level, or above it. So poor is considered below the poverty line, near is 100 to nearly 200% of poverty, federal poverty level, and then low income is 200% of the poverty level. So again, looking at children here, 61% are above that low income poverty level. However, you can see that we have 39% who are 200% of the poverty level. We have another 18% that are at less than 100% of the poverty level, and then a 9% who that are in deep poverty. So if the current minimum wage, which is $7.25, and you worked 40 hours, what would be your income? And what would it be if you went to $15 an hour? How much would you make? So $15,000 is all you make if you are at the current poverty level, or the current minimum wage, which would increase to $31,000 if you were at $15 an hour. And if you calculate out, cost of living, car insurance, car payments, cell phone, internet, all of those things, you'll see that $15,000 in no way, shape, or form stretches far enough. So here are some budget calculators. They're kind of fun to play with. But in order to have a secure yet modest living, meaning that you're not worried about money for food or rent, it does vary significantly based on where you live. But even in Mississippi for 2024, you need $67,000 for a family to have a modest living. In Topeka, Kansas, it's $80,000, and you can see New York, it's $150,000, greater than $150,000. So, and you can see again that there's been significant increases in how that dollar amount need is, it's just gone up. Do the supplemental programs that we have make a difference? Absolutely. If we had no programs, the poverty level for children would be 33%, whereas with the government support programs, we've been able to drop that down to 18%. And this chart shows you what the poverty level would be if we didn't give tax credits for children, and we didn't give SNAP, which is food stamps, we didn't give housing subsidies. So again, these programs make a huge difference in pulling children out of poverty. What kind of programs do we have? Under the Department of Health and Human Services, we have Head Start, we have Medicaid, and you can see that there's several other ones. Interestingly enough, they divide these up so that SNAP and WIC and school lunches are all under the Department of Agriculture, and every year it's this huge argument, budget argument over how to fund and support these programs that pull people out of poverty. So let's look at where we have gone over the past 25 years. Childhood poverty, again using the supplemental poverty measure, and the solid line is the U.S. The solid line is South Carolina, and the dotted line is the U.S. And you can certainly see where that South Carolina still comes close to the U.S. level, but you can certainly see that we have a significant portion of the population who are at child poverty rates. Again, these are trends looking at the percentage of children who are poor or near poor, and we really haven't made an awful lot of improvement since the late 70s, early 80s in dropping those percentage rates. You can see again that if you are a single mom, the poverty level, living at below the federal poverty level, is around 40%. With children under, single dads is much less, at slightly less than 25%, and a married couple is less than 10%. So again, data supporting that what type of family you live in certainly has a strong determination of poverty. Extreme poverty for those living on less than $2.15 a day. We've made some improvement in that over the time frame here, and you can kind of look at those as well. You would think the U.S. would be, because we are a highly developed, industrialized nation, that we would have less childhood poverty than many countries around the world, but as you can see, we are towards the bottom, with only Romania below us. So you can go ahead and click on these links. They'll give you an idea of poverty state by state, and it is kind of interesting to look at where are we in Charleston, South Carolina. Again, thinking about poverty, what does it look like where we are, where you live in particular, Waterboro versus Somerville versus some of the other rural areas, and how does that affect childhood care and health, as well as their ability to access those things. Education, again, we've made some strides in having people have at least a high school education, but we still have 12% or so of the population that has not been able to complete high school. How do these biases affect patient care? So again, think about a family living on $600 a week, and how does that affect their ability to find a place to live, find a job, avoid some of the trappings that are of drugs and violence. And here's the video of a child who is living in a homeless shelter and what her life is like. So again, after you've watched that, kind of reflect a little bit on these questions. So some take-home points. Think about what poverty looks like, and were there any surprises? Do you have any personal assumptions or biases or stereotypes that might affect how you care for patients? And then consider, again, how could you implement or screen in a clinical setting for poverty? And again, I don't think people generally choose to be poor. It is, again, we'll talk in the next one about social determinants of health that pretty much sometimes define what people's lives and outcomes are like. So there is a screening tool that can be used. It's called the Hunger Vital Sign, and it's been validated with just 2 questions. And you ask them, over the past 12 months, have you worried about whether your food would run out before you had money to buy more? And within the 12 months, the food that you bought just didn't last and you didn't have money to get more. And so these are some quick ways to kind of assess if there is food insecurity in patients, and then try to make the appropriate referrals to help support the patient/family. And that's the end of that.